Chief Medical Officer Dr. Jacqueline Besesa McKenzie says 14 people who were in immediate contact with the patient should now be in quarantine. She says different groups of contact have been identified. And Minister of Health, Dr. Christopher Tufton, says a decision might have to be made to convert some wards at hospitals into quarantine units if there is community spread of the coronavirus in Jamaica. He says this could result in the early release of patients.
And some people who may think they need hospital care may have to be taken care at somewhere else, whether at the institution, another institution that we create, or at home. So one of the responses to community spread is going to be to equip or retrofit a particular ward in a hospital as a COVID-19 ward. Now, you know we don't have these wards waiting for COVID-19. Every bed is taken up. So what it means is that someone who may have a diabetic condition or a stroke or some other condition that requires some levels of hospital care or the social cases, every hospital that will have to vacate and isolate that ward. And it means displacing some persons in the system.
And the chief medical officer gave details on the people who have been identified for testing.
We also have the general practitioner that the patient visited. And so we have that investigation that is ongoing as well. We have already have discussions with the general practitioner. We're getting the list of persons that may have been in their facility and to assess that kind of exposure to get into contact with those persons. Then we have tracked, by now we have a complete tracking of where the patient has been. And so we will also be looking at those situations as to where it is that the person. So we're really looking at the contact with the person of interest.
Kimberly Broderick, Frontline News.